Present the case. Okay, we present the case. History.
A 42-year-old Frankie who has presented with the complaints of postpartum bleeding since past 2 months. The bleeding is mild to moderate in amount and lasts for 1 to 2 days. She had been getting regular pap smear examination done in the past. The last smear done 1 year back had shown normal pathology. She started her sexual relationship at the age of 14 years and since that time has had many sexual relationships until the age of 28 years when she got married. Since then, she has been in a stable sexual relationship with her husband. She had her first child at the age of 29 years. She does not give any history of ever having had suffered from sexually transmitted diseases. There is also no history of any significant medical or gynecological illness in the past.
Then clinical examination.
Clinical examination.
Yes.
General physical examination, the patient looked thin and emaciated, but one was well-oriented in time, place and person. Her vitals were within normal limits. There were no significant findings on general physical examination. Per-abdominal examination. The abdomen was soft and non-tender on palpation and there was no significant finding on per-abdominal examination. Per-speculum examination. On per-speculum examination, a macroscopically visible cauliflower-like proliferative growth was present. The growth was muscular, friable, and weak on touching. The lesion was found to be about 3 cm in size, and there was no necrosis or ulceration in the surrounding regions. The growth was limited to the cervix, and there was no apparent extension into the vagina. An offensive foul-smearing mucoid pleural blood stain discharge was also absent.
Would you understand? Okay? Just on vision about the scenario. Later I will talk. Then?
Colposcopic examination. Features of malignancy were observed on colposcopic examination. Per-vaginal examination. On per-vaginal examination, a rounded growth about 3 cm in diameter could be identified on the anterior lip of the cervix. The uterus was anteverted, normal-sized, and freely mobile. The tumor did not appear to involve the vagina or the parametrial tissues and the pelvic side walls.
Just up to this, we focus the examination findings, okay? And then investigation.
Now investigation, colposcopic directed biopsy. A colposcopic examination was carried out both after the application of acetic acid solution and Lubbold's iodine. Following the application of Lubbold's iodine, the normal cervical cells turned mahogany brown in appearance, whereas the abnormal areas did not take up the stain.
So abnormal cells did not take the stain, okay? This is MRI find the pans biopsy.
Pans biopsy. The biopsy result indicated the presence of invasive squamous cell carcinoma. Investigations for cancer staging. For staging of cancer, the investigations which were done included examination under anesthesia, MRI scan, cystoscopy, and proctoscopy. The results of these various investigations showed that the growth was limited to the cervix and there was no extension outside. The tumor had not spread outside the pelvis and there was no lymph node involvement.
Okay. Then diagnosis.
Diagnosis. The diagnosis of cervical cancer stage 1P1 was established. The results of histopathological examination revealed invasive squamous cell carcinoma. Treatment. In this patient, surgical treatment in the form of radical hysterectomy with pelvic lymph node dissection was carried out. For details regarding treatment of various stages of cervical cancer, kindly refer to the chapter 23.
Okay. Then discussion.
Now discussion. Presence of postcoital bleeding is a significant complaint which demands appropriate investigations in order to establish the diagnosis. Postcoital bleeding usually indicates a structural lesion of the cervix or vagina. Various causes of postcoital or postmenopausal bleeding are enumerated in next table. Infectious etiologies such as chlamydia and gonorrhea are common causes of postcoital bleeding, which must be excluded and treated if required. Uterine or cervical polyps may also be a source of bleeding. Dysplastic or malignant lesion of the cervical or vaginal epithelium may cause irregular or postcoital bleeding.
Okay. Thank you. That is it. So, just one vision about the scenario and what we need to do and what we do and what is the management. Okay. Now I go to the theoretical classes, that is. So, introduction. It is the commonest cause. Already I told, and you see that every 2 minutes a woman dies from the carcinoma cervix all over the world. You see, every year approximately 12 women are diagnosed with carcinoma in Bangladesh. So how many? 70% of these patients within advanced stages. Okay? You need to understand what the situation of our country. So it is it a preventable disease? Yes. So prevention always better than cure. So it is a preventable disease. How can we prevent? By screening and education. And you know the primary, secondary and tertiary prevention. What is primary prevention? Education about the disease and how to find out who are the risk persons. Secondary is the screening and treatment. Okay? Tertiary is the surgery. That is so primary prevention, secondary and tertiary prevention. What is screening? Screening is a key. So, it is a suitable less cost test that is easily done, and treatment can be given to diagnose any serious cases. Serious cases by simple test, less cost, and which is treatment is easily done and by earlier diagnosis. Okay, earlier stages of a disease. You know, I think from community medicine, you know what is screening, mass screening, individual screening like this. Can you say anyone any screening method of carcinoma cervix? Who is no? Pap smear, okay, via at the rural level, our via you know the via visual inspection with acetic acid. If any abnormal cell, it is done actually acetic acid. 5% acetic acid is applied to the region. That is cervix, we can apply to the cervix, we can apply to the vagina, we can apply to the vulva. For what? To see any change. What change? What change? If any white. Why white? There is if any abnormal protein or excess protein, it undergoes coagulation with the presence of acetic acid. When acetic acid is given to the abnormal tissue containing high protein, it changes the color. It becomes whitish or white, pale white, dark white maybe. So that is via. And what is pap smear? For the abnormal cell. How cancer is? Is it from starting or it is later? Later. So abnormal cell become malignant. Normal cell become abnormal cell and then malignant. How it becomes? Normal cells become abnormal. Some changes either there should be some changes by infection like human papillomavirus or some environmental change or any genetic expression like this. So there is metaplasia or dysplasia, and then it is transformed into malignant cell. Okay, so we should know about this pathogenesis. And so screening pap smear is the procedure by which we earlier find out the abnormal cell like metaplastic cell, atypical cells, or sometimes we can find the malignant cell also. So this is pap smear. Another screening what is test? That is leukocytin, mahogany color. You to read already, mahogany color. Mahogany color, you know every cell contains glycogen. Okay, understand? Glycogen. In abnormal cell, normal cell contains glycogen. Abnormal cell, glycogen is exhausted, already used up. So no glycogen. But in presence of glycogen, if you apply the leukocytin, it becomes mahogany color. So abnormal cell contains no Mahogany color. Okay. So these are the screening. Another screening is SPB DNA test. If you wants to know the what is the organism, usually mostly by the human papilloma virus 16 and 18 causes carcinoma. So SPB DNA marker is also one of the screening tests. And there is also other screening tests like cervicography and like this. Okay. So we proceed next. So we should know the anatomy of the cervix. For every pathology to understand, we should know the anatomy. How it looks as normal cervix, tubular, some 2.5 centimeter, and also circular, and cylindrical appearance like this. So if any change in the normal anatomy of the cervix, we should suspect something. Okay. So we should know that cervix contains ectocervix and endocervix. You know, ectocervix is stratified squamous epithelium, endocervix is columnar. There is a transformation zone, and from this transformation zone, the pathogenesis started. Immature cell that is very susceptible to any infection, any change. These are the like this. You should know. This is just I highlight the anatomy. You know this is what is this? Uterus, cervix, and in front there is a bladder. This is ovary, and behind rectum. Okay, and this is urethra like just anatomy. So if cervix is affected, suppose carcinoma malignancy, it goes where? In front bladder, behind rectum, and you can feel any change through or vaginally. You see how lucky we are. Always Allah makes us to understand easily. And you see carcinoma cervix is common, and we can easily find out, we can easily examine earlier. How? By inspection. If we see the cervix, we can diagnose, and by easy test. So you see easily. It is easily preventable disease. Okay. Now we go the second slide. This is the changes. You know the stratified squamous epithelium. There is change. This is normal, and then the changes is here started. Columnar epithelium. This is normal. This is crypts of the epithelium. This is normal or abnormal? Normal. Okay. I am going faster. Okay, this is normal. I am showing all the normal. Here you see the transformation zone and the cervix, ectocervix. Okay, and like this is normal. Going through this. Okay, that is important for you. Everyone is asked about this. What are the risk factors of the carcinoma cervix? You see in the books it is written nicely. Early sexual intercourse. If there is before menarche like this, there is more immature cell. If more immature cell, more susceptibility to the change infection. Early age of first pregnancy, too many frequent childbirths. It is confusing nowadays. Anyway, low socioeconomic status. That is, if the patient is poor, hygiene is also poor. So problem. And multiple sexual partners, that is very important. STD, human papilloma virus like this, immunosuppressed, if the patient is suppressed for different reason. Husband whose wife is died before carcinoma cervix, nowadays suspected oral pill. Oral pill, how it is causes metaplasia change. Hormone causes metaplastic change. So it is also, and smoking habits. These are always asked in question. What are the risk factors for the carcinoma cervix? Okay. So carcinogenesis, the pathogenesis. I told already there is metaplastic change, and then the process starts. So the notorious organism. What is the notorious organism? Human. Very good. What are the strain? 16. Very good. What is the change actually? You see cervical CIN, very important term. Cervical intraepithelial neoplasia, that is within the epithelial structure, not beyond this, not invasive. So it is pre-invasive. So it is the pre-runner of the carcinoma. Pre-runner of the carcinoma. That is cervical intraepithelial neoplasia. And mutagen, what is mutagen? Human papilloma virus causing. Okay.